Hi, everyone. Thanks for joining us on webinar number 2, How to Run Effective Patient Journey Innovation Workshops. We'll be talking about how to coordinate teams through facilitated co-creation. My name is Neil Chaudhari. I'm one of the founders here at Propane, the CEO, and I'm joined here by Alec, who is our Director of User Experience. We've had the benefit of working in healthcare for the last 15 years, covering brands like Kaiser Permanente, Sutter Health, Aetna, Banner, Grand Rounds, a bunch of medical startups, and then medical device, medtech as well. So it's been a really interesting journey, and these workshops have really given us a lot of insight and innovation opportunities for our clients. And we hope that today you'll be able to take some of this insight and go run these innovation workshops internally with your teams. And we hope that you'll walk away with some structure, some tools, some tips, and some context as to how to get the most success from those innovation workshops. So without further ado, let's get into this. Alec, do you want to give us a quick rundown of why patient journey innovation workshops are, what they are and why they're important?
Yeah, absolutely. So for us at Propane, we know that when you're working in healthcare, we see a common pattern where departments operate in kind of silos. And what that means is sometimes the patient journey can actually suffer because you don't have teams working across their functions to put the patient journey at the center of their work. And so we created a workshop process called the Patient Journey Innovation Workshop. It brings cross-functional teams together in a series of sessions where you run pre-planned activities around the customer journey and the customer experience of your patients to understand what their pain points are, to drive empathy with them, and ultimately get to a point where you can ideate and innovate new solutions that improve their experience working with your healthcare system. They're great to use when you are redefining the types of strategies and planning your work for the year. If you're addressing sort of low satisfaction scores that might come in around certain parts of your experience, if you're launching new services or products, and even just to optimize efficiencies across the patient care pathways that you might have. So we really see them as a powerful tool, and I'm excited to share more about how to run them for your healthcare system.
Awesome. The first part that we want to cover is really about workshop preparation, gathering context, mapping the problem space, and assembling the right cross-functional teams. And we'll talk about what that means. The second part is really about running the actual workshop itself. So preparation, workshop execution. We'll talk about activities that you can use, exercises, how to sort of organize and rank the innovation ideas. And then we'll talk about how to bring that innovation to fruition, really talking about how to present this to leadership and what that looks like. A lot of these ideas that we've collected over the years are really best practices that we've had the benefit of learning from brands like IDEO or even an older company called Adaptive Path or a lot of strategy consulting type of work that's out there. But actually putting it in practice gave us a lot of the insight that we have. Like I said, we've been in the healthcare industry for 15 years. And so we've done things generally in a very collaborative, innovative type of way, but really the experience is key. And we hope to share that with you during this webinar. That being said, when we start the innovation workshops in terms of preparation, it's really about setting the foundation. And we really want to create or build a customer point of view. So we'll talk about that and what that means, but it's really about mapping points and what the needs and wants are of your customers. Then we are suggesting to actually develop the proper amount of market context. In addition to market context, understanding your business and what your business goals are is critical to making sure that innovation workshops actually see the light of day. It is good to draw a line in the sand and complete a maturity scorecard, knowing what your current score is today and proposing to your leadership team that, hey, if we do these innovation type activities, we look to improve the score by X or score by Y. And then last but not least is really assembling the right team, bringing cross-functional teams together. This is really just a convergence of customer understanding, market understanding, business understanding, knowing where you're currently at in reality, and pulling the right teams together to really set you up for success. The takeaway here is that a well-structured problem space creates well-structured solutions. And that's really what we're trying to set you up for. That being said, for preparation step 1, building that customer point of view, Everyone talks about personas and they generally, have a one pager that's got an image and some stats about people. And that's great. That's totally helpful. But we actually encourage that you take more of a life cycle approach, that you map the personas across the entire patient journey, not just in single touch points. And that you also look at the emotional states, the pain points, and the goals of each stage. Why does this context matter for this particular patient while they're in a particular phase or engagement with your brand? So to dive deeper into that, Alec, I'm going to turn it back to you in terms of letting our audiences know what are some good activities or options that we have for building customer point of views.
Yeah, absolutely. So if you don't have personas already, this is a great way to get a fast persona created ahead of your workshop so that when you go into the workshop, you can share that context with the team and you can all align on who you're trying to help and who your patients are. At the same time, you could also even consider doing this during the workshop. But for now, we're recommending doing it ahead of time so that you have it prepared. And this is a framework from a company called Strategizer that's called the Value Proposition Canvas. And on the right side of their canvas, they have what they call a customer profile. And so, a really simple way for you to just capture a profile of who your potential prospects or patients are is to really understand what are the things they're trying to do in their day to day life, what are the pain points that they experience, and what are the gains they're hoping to achieve. So, something like this might look like, hey, potentially you have a potential patient profile who has to, drive their kids around and get them to soccer practice. She has to maybe take care and get her aging parents to their medical appointments. Maybe she has to get her kids to their annual checkups. So those are all the jobs that she has to do that might relate to the work that you do. What are the pains she experiences? Well, she has a busy schedule. She has to try to fit this in during the workday in between 9 to 5 for all these appointments. Maybe it costs a lot of money. Maybe she doesn't have great insurance. All these things are the types of pains you start to dive into and capture to profile them. And then what are the gains she's hoping to achieve? She probably is hoping that her family is healthy and stays healthy, that, her parents live long, healthy, active lives. She's probably trying to get her kids to get off screen time and do more things and eat better, all those types of things. So those are the types of gains that you could capture in a profile as well. And so once you go through and you sort of build out an understanding of who your customer profiles are, and you don't have to do just one of these. You can do these across multiple perspectives, like Neil was saying, across life stages. So a woman who's going into potentially being pregnant for the first time versus a woman who's pregnant for the third time versus somebody who's aging and just throughout the life cycle that they experience. So you can have multiple customer profiles going into the workshop.
Both of us being parents, I think screen time is definitely an issue for kids. So with that, while you set up these canvases, that's one option. Another option is really looking to your internal staff. If you happen to be a slightly larger organization, sometimes you have the benefit of having somebody in a patient engagement position or a patient experience position. And if you do, generally they have customer or patient experience journey maps. So pull those from that person if you can. Also look through your company hard drive to see if somebody has maybe procured another outside firm to develop those. Oftentimes when smaller innovations are made, that particular strategic partner might have made a journey map as well. Pull any and all journey maps that you have together and really look at those maps and see a lot of that insight. We're really trying to surface a lot of that work. What we oftentimes see is some of these maps are partially filled out at organizations or healthcare systems. Some maps just aren't done at all. And if there are maps, they're not really shared or distributed against all the people that could really make use of them. So take the time and energy to look for them and see how that works out. When you're thinking about these patient journey experience maps, also note on a second webinar or another webinar later, we actually have a point of view on how to measure this as well. Something that Alec and I have put together, and we'd love to share that with you. And what that looks like is taking a journey map and installing the right type of software to give you signals on whether you're doing poor or great in any of those specific areas. So again, topic for another day. Now that we're done with sort of looking at the overall customer point of view and trying to build it out, the next one really is about developing market context. We really suggest to look at your competitive set. And when you're looking at competitive set, you could build something as easy or simple that's on the left side chart, which is basically a comparison matrix. And as you're listing down your competitive hospital systems, look at what their best features are. Look at what they're known in the landscape for. Look at their support. Look at their communications. hospitals, look at their brand mission or statement. Some hospitals specialize in children's health, some specialize in seniors, some specialize in academic, some specialize in community. So try and get a good set or evaluation or analysis so that it can be a really powerful input into your innovation workshops. The second thing, too, is also looking at benchmarking. As you've taken the time and energy to map out what all of your competitive sets are, sometimes it's a really good idea to set up good XY axis. Now, typically for startups, those XY axes are generally against price, high or low, or quality, high or low. But you can look at other axes, things on quality of care, speed of care, specialization, innovation, doctor expertise. We call it bench. Maybe it's facility experience. So take into account all the different vectors one might have or that your customer might be looking at, and be flexible with those XYs and see where they scatter plot. Those will open up opportunities for you as you get into your innovation workshops. So with that, let's go to part B. Now that you're, looking at sort of market context, there's a second area in looking at consumer experience trends. Alec, you want to take us through examples of what we mean by consumer experience trends?
Yes. So if you think about your patients, they're living daily lives when they're not at your, healthcare facilities. And in those daily lives, they're coming across all different types of digital experiences that, have over the past decades revolutionized the way that they get their work done. They complete those jobs we've talked about, they experience and alleviate those pains, achieve those gains. And so understanding important trends that are happening in digital experience is also great preparation work to do before you go into the workshop, as it will help you align with what types of expectations your patients and consumers have in general. Here's 4 common trends that exist today. This is by no means exhaustive, but this is a great place to start. Things like Uber or Lyft, people are expecting to be able to actually get real world seamless booking happening through digital experiences. You can always ask yourself, okay, so how does that relate to healthcare? And, obviously booking appointments, managing appointments, getting rides to appointments, etc. There's all types of things that we can do to help alleviate pain points through the customer journey, taking a seamless booking perspective. Efficient calendar notifications. Obviously, we want patients to show up to their appointments. They're using calendars in their everyday life. This is a trend that would be useful for considering and bringing into as part of the context for setting up your problem space for the workshop. One of the things that we're always really excited about at Propane is loyalty and gamification. So if you look at the Starbucks mobile ordering app, the way that you're rewarded for using the app more and more with real monetary rewards is something that keeps people coming back and encourages them to actually spend more. Thinking about how maybe loyalty and gamification might fit into your healthcare system is a really interesting way to take a consumer trend that's popular and think outside the box to create innovative new ideas. And obviously with AI today, things like ChatGPT, Claude, we know that consumers are using it more and more every day. And so just asking yourself that question of how might AI fit into our customer experience is a great piece of the context to bring into preparing for your workshop. Like I said, there's obviously more trends out there, but getting them on paper, getting people to agree and align with them as part of the context building as you bring those cross-functional teams together can help get people to have new collisions and innovative ideas happening. Definitely exciting stuff to research and look at and bring into the problem space.
I think that's great. We happen to be a digital agency, and a lot of what we're talking about is from a digital lens, but think omni-channel as well. Think where are they at in experience in real life? What are they listening to? What are they doing on their desktop? What are they doing on their mobile, as Alec had mentioned, through these digital applications? Be flexible in sort of where consumer engagements actually are, because those are all possible to kind of pull into your innovation workshops. That being said, the next area is really about business context. It's really good to look at your marketing departments for a map of your technical architecture. That's generally a map that's got all the different marketing systems, be it email, be it CRMs, be it any kind of communication, even SMS. Ask them for that. And if they don't have that, we highly recommend that you create that, even if it's a loose sketch, because again, that will serve as a really good input into your innovation workshops, knowing how your marketing is actually going out and reaching out and what existing channels you have. A second part of this, which is critically important, is really the OGSM, the objectives, goals, strategies, and measurement. There's a chart here or a diagram that you can use to get that. Again, some health systems have this that's distributed well, some don't, but this is also really important in terms of attaching some of your innovation ideas to particular strategies or goals downstream. And last but not least, in terms of business context is really the partner ecosystem. Know what EHR system you have, which most do. But in terms of EHR systems, there's sometimes ancillary systems. You might use a particular software for managing just the booking or managing just the email or managing telehealth. Know what those companies are, know what's available to you so that when you are ideating, you'll be able to take those into account and further the utilization of those solutions or add to those utilizations as a whole. Those are just essentially the technology vendors that exist even outside of marketing and are maybe more on the clinical patient side of things. And last but not least, assembling the right team. And this is sometimes probably the hardest step in developing the right sort of preparation. And what we are suggesting is that when you run these innovation workshops, your relationship to success is highly dependent on the diversity of participants that you get. So really do try and find people from clinical and medical. Obviously, that's very important, but even support services like diagnostics and imaging, again, having people represented from marketing is important. Patient support services, we find in outpatient, very important to have that representation there. And if you can get specialized units that your particular health system might have, invite them in if you can. And last but not least, from a goal and strategy standpoint, getting executives or administrative staff into the mix is going to be amazing. You're really, again, trying to get a diverse cross-functional perspectives across your organization to be participants in these innovation workshops. That being said, let's move on to what it looks like to actually run the workshop.
So as you imagine, you've prepared all of this context. You have all this rich context that you can actually share with your cross-functional team. Now today's the day. You're actually going to get people in a room. We recommend a really big, nice room that has walls where you can put things up on it, whiteboards, whatever you might need to be creative. You're really trying to make it a comfortable environment for them to feel like they can let their ideas come out. There's no such thing as a bad idea, etc. And so as we look at running the workshop, we want to take it into multiple sessions, like we said before. So we'll start with session 1. And in session 1, what you're doing is you're building alignment across the entire team that you've brought together. So again, you might have IT here, marketing here, clinical providers here, and you want to make sure that they can all understand all that rich context that you prepared. So you want to align on your customer and what it is they're trying to achieve, what parts of the journey that you might be struggling in. So you can review that journey scorecard to see where you might have opportunities to improve the patient experience across the journey. You want each cross-functional perspective to actually share insights and have their own perspectives and bring that into the mix too. Someone in IT might have a different understanding than somebody in marketing, than a clinical provider, than patient support. And so we want to make sure that there's room for all those different ideas to come together. And ultimately, by the end of the day, what you're trying to do is build empathy. So you want to make sure that you're coming away really having the patient and their experience at the center of your conversations. So by the time you finish the day, you'll actually have a really clear, visually designed board that explains the customer journey, denotes where you have opportunities along that journey that you want to focus on, and then ultimately understand what the patient's experiencing at that journey today and how we might be able to help them have a better experience through innovative or new ideas. And so session 1 is really about just getting everyone on the same page and sharing context and making sure there's a lot of empathy for our patients and the patient experience to make our services better.
So in that, this is where it starts to get really fun, and we recommend you doing this in person. It can be done virtually, but these are essentially innovation activities. And so one of the first ones is a how might we activity, and we'll talk about that in a second. The second one is crazy eights, and these are by no means exhaustive. They're just a blueprint that we're giving to you. Crazy eights, you're drawing things. We'll talk about that, storyboarding, and then ultimately doing headlines and vision. So imagine that your workshop session 2 is really about understanding, ideating, and sketching concepts out. Determine at least 3 activities. You can have 4 or 5 if you can fit them in, but generally run your audience through those different activities. This is really about prompting everyone to work on the same problem areas together as a team and generate a bunch of ideas. Let's take a look at what these activities look like in practice. Alec, do you want to tell us about how does the how might we activity work?
If you think about back to session 1, whether you do it session 1 on the same day and then session 2 after lunch, or, whether you're spacing them out across multiple days, days or multiple weeks even. When you're coming out of session one, you have a really clear understanding of the patient experience that's shared. You have areas of opportunities that you might want to be focusing on. And a lot of times you're coming out of session one with a pain point that's like, our patients don't show up to appointments and we're losing revenue because of that. And what the purpose of the how might we question is, or the how might we activity is to now reframe that pain point into a inspiring prompt that allows people to generate ideas around. It's not just simply saying like, how do we fix people showing up to their appointment? Because that make it sound like there's only one answer or one right way to do it. Really what you want to say is, how might we ensure our patients arrive at their appointments on time? And now all of a sudden, you can see there's 100 different ways you could skin that cat. Oh, what if we offered in-app Ubers? What if we offered discounts for Ubers? What if we did X, Y, or Z? And so all of a sudden, you get all these cross-functional perspectives working together to answer that how might we question as you go on throughout the session. And so they just become the really powerful foundation for you to frame the problem in a way that's inspiring to generate new solutions. We recommend that it maybe take 10, 15 minutes to turn those problem statements into how might we statements that feel inspiring. And by the end of it, the outcome is hopefully for your average session, you have 3 to 5 how might we prompts that you then use to go into our next activities, which are crazy eights.
On the crazy eights, which are one of our favorite, I think Alec and I both really enjoyed this part the most because we've done all of this preparation work and now we get to see what these ideas look like. It's essentially taking a piece of paper and folding it into 8 squares. And the how might we prompts, or outputs that Alec had just talked about, those are put up and the entire team is then asked to spend 1 minute each thinking about how they would solve that particular how might we. The brain is forced to go a minute, a minute, a minute. And what happens is that you're drawing these concepts out, you're forcing your brain because of the time crunch to think creatively on how to solve it. And then you're taking a quick pause and you're trying to tackle the problem a different way, really looking at the problem and giving your mind the space to kind of hit it from different ideas is amazing to watch. What you'll find is that sometimes the first idea is the most obvious, but then since your brain has kind of got that out of the way, it moves to a different point of view or a different set of creativity and moves its way down. Now, for those of you that are worried about your drawing skills, don't worry about it. Just sketch it out as best you can. You can also see here that a few of our, clients have decided to write things out as well. You can do either one. It doesn't matter. Sketching or writing is totally fine. The point here is about this being a rapid ideation technique to get people to focus and put them in a mindset that tackles the problem in different ways. Once you're done with that, you're going to have a wide variety of ideas that are canvassing the how might we's across the patient journey. And because they're produced by cross-functional teams, you're going to get lots of different takes on how to solve that same problem. And those problems or those solutions might actually start to complement each other or might actually start to be similar to each other or might extend off each other. The next part is really storyboarding. So from the crazy eights, the session might be to evaluate some of the crazy eights and determine which ones are worth moving forward. You'll know pretty quickly which ideas surface well because you've taken the time to kind of share and present. And sorry, I left that part out. When you're done drawing those up, you do get the chance to stand up in front of the team and explain what your crazy eight is. And so the overall group has a good sense of which ones they might want to advance. From that, you can go dive deeper into the storyboarding. What the storyboarding does is take that small square idea that you have and really expand it into looking at all the steps before and after and during that particular idea. So to get to that particular idea, maybe you needed to go online, or maybe you needed to talk to somebody, or maybe you needed to pick up a phone call. Afterwards, maybe you needed to follow up with somebody or send a file to somebody. And so really having the full picture end to end on what that particular idea is broken out into a storyboard format starts to not only become really fun, but also starts setting the context or the stage for potentially prototyping that idea. That's why it's really important to get into storyboarding. Pro level tip too, if you want to get through this a little bit quicker and you're trying to jam a bunch of activities, It's totally fine to have a sketch artist. They're pretty affordable these days, and they can even help you sketch out these storyboards according to your direction. So at the end of the day, illustrated storyboards for feedback and these activities between How Might We's, Crazy Eights, and storyboarding, there is a whole plethora of other activities. Doc, if you want to tell us about this on where you can get more.
Yeah, absolutely. So we're talking about Crazy Eights and How Might We prompts and storyboarding, and those are just a small set of types of activities you could do during your workshop. You're going to know your cross-functional team better than anyone else, and so I highly recommend checking out Game Storming. It's a book published by O'Reilly, but also it's a website, gamestorming.com, where you can go and there's a whole database of activities that you can run during workshops, and they're all about co-collaborating and co-creating together, and they treat them as games. They have rules, they have things that you need to do it, they have time boxes, they have instructions for the facilitator. It's a really great resource to help you creatively figure out what are the best types of activities we could do in this workshop to pull out the best types of insights that we need. The four that we're presenting in this webinar are some of our favorites and ones that stack really well together to go from a prompt down to a more refined idea such that you can vote on it later. But totally recommend checking out gamestorming.com to see how you can complement your workshop when you actually come up to running it.
And the fourth one that, in terms of his activities, was really headlines and vision. Just for sake of timing, we cut that out, but just to give you context on it, is looking at the ideas, and if you could make a pithy statement or a headline, what would that be? And that really helps in your ability to package and champion that idea forward. So smaller activity, usually around a lot of words, in terms of how to describe certain things, generally worthwhile from our standpoint. So the next session is really about deciding the direction, moving from many ideas to clear priorities. One is to organize all of those ideas and really map them out by patient journey phases so that you have a group shared visibility. So if you've got 50 ideas, to then group them by phase allows you to get a bird's eye view about how all these innovation ideas are related to the various stages that you've set up in prior sessions. The second one is about voting. We'll get into that. And then the third one is about prioritizing using an IEM framework. So let's get into that. All right, so in terms of organizing, here's an example. You can see, Sophia's goals and sort of her current situation. Here's maybe Sophia, dating plus her first job. And then there's Sophia getting married. And then there's Sophia having and starting a family. It doesn't have to be in that particular order, but the point here is to really organize these cards as such. Then once they are in their actual column for a phase, start to group things thematically. What might be awareness? What might be onboarding? What might be engagement? And again, having those previous patient journey maps or some of that earlier context that you had set up is really going to help you organize these ideas. The goal here is really to get shared visibility and look at the entire landscape. Once that's sort of organized correctly, you'll be in a good position, rather, to move on to the next step, which is really to start voting on them. Alec and I tend to use a 2-round setup. Alec, you want to walk us through the stickers and how we leverage them?
Yeah, when we're looking at voting, you have to imagine you have all these ideas up on the wall. They're all organized, like Neil just said, and you want your team to get up out of their chair, come up to the wall with all the ideas on it with stickers in hand. What you're asking them to do is, first round, vote for which of these ideas do we think are going to be the most impactful for the customer experience, even also most impactful for the business. Which ones deliver the most impact? They'll put their green stickers on the ideas that they think are most impactful from their perspective. It's also a good idea to maybe limit the number of stickers they have, give everyone 10, or depending on the number of ideas you have, give everyone 15, so that they're forced to make hard decisions about which ones they think are impactful. Then you have them get up out of their chair again for round 2 and give them a different color sticker, red or blue or whatever. And this one's going to be for effort. And so which of the ideas are actually the easiest amount of effort, the lowest amount of effort to actually implement? And so what starts to emerge here, like in real life, is a scatter plot in front of your eyes of which items are high impact and which items are low effort. And that's going to take us into the next step.
We tend to look at IEM framework as sort of effort impact matrix. But as Alec had mentioned before, you've got a bunch of green stickers and you've got a bunch of red stickers. If you've got highest impact, lowest effort, that's obviously in that sort of quick wins category. If you've got, high impact but doesn't have that red sticker, those are potentially good major projects that you want to tackle. The fill-ins are the ones that are ideas that are good for a backlog for future consideration, and those will surface as you're looking at your scatter plot. For fill-ins, there would be ones that are just the green red sticker, and then thankless tasks are the ones that don't have red or a green sticker. So they'll naturally fall into that category, and you don't have to get rid of them, but you can park them for now because you've got plenty of other ideas and plenty of other things that are going to advance to the next stage. At the end of the day, you're getting a bird's eye view of this, and you're looking to prioritize and have good rationale for the near-term and long-term focus for your innovative ideas. When you're done prioritizing, you're in a really good spot. Your workshop's over, and now you're in a good position to try to make these ideas real. But to do that, you really want to pick the top innovations that are worth investing in. And what we recommend is using an HCD framework. HCD, look it up online if you're not familiar with it, but really it's 3 circles that are a Venn diagram. You're really trying to find the intersection between desirability, feasibility, and viability. Once you've got your sort of winners run through an HCD lens, it's going to put you in a position to start creating and rationalizing these ideas. And what we suggest to our clients and partners is that do the feasibility assessment, but create the business case. Start to look at what are we investing in? What is the amount of resources it's going to take? How long is it going to take? And ultimately, what impact is it going to bring to the business? Why? Because at some point, you're going to have to pitch this to leadership to get funding. And leadership, as we all know in hospitals, have tremendous amount of pressure and initiatives competing for their budget. And that's generally where innovation gets killed. So if you are already a step ahead saying, hey, this is how it's going to help us, this is what we think, and you don't have to be 100% right about the impact, but you directionally need to be able to make an argument. If you're in a position where you can invest more dollars and cents to actually put a business analyst against it or do the necessary research to make up the mock financial models, great. But really giving an executive a package that's got the business case, the amount of creative and technology that's needed and the timing that's needed against it, that's going to make a huge difference in your ability to get those innovation ideas through. That being said, Alec, do you want to close us out with key takeaways?
Yeah. So the things that I would love for you to take away from this webinar are that, one, if you're going to run a workshop to create innovative ideas like this, preparation creates success. So if you get the right context, the right problem space built around the customer, understanding your competitors and the market landscape, then understanding your business and making sure you're aligned with the types of ideas you're coming out, that they're aligned with your business, you will actually create great innovative ideas that do get through and do get brought to life. 2, cross-functional collaboration is essential. So bring together multiple perspectives. We know it's hard to get everyone's time all at the same time. We know it's hard to get them in the same room, in the same place, but it's worth it. When you're bringing those different perspectives together, the level of understanding that they have about the patient experience is going to be so much more rich because of their unique perspectives. 3, these types of structured workshops drive results. And so we know, we've seen it firsthand, as Neil was just saying, it's been the start of a lot of great projects for us that have come to fruition. And we highly recommend that doing the work to plan the workshop, plan the right activities, and draw the right insights out of people will get you results. And finally, well-structured problems create a well-structured solution. So if you have a really clear understanding of your problem, you can really develop great innovative ideas that ultimately optimize your patient journey, bring it to the next level of maturity, and help you stand out from your competitors in your patient's eyes.
Thank you, Alec. That's great. And just to add on to what Alec was saying, really at the end of the day, if you're looking at the patient journey and you, for the year 1 roadmap, are impacting 3 or 4 opportunities, it doesn't have to be a lot, you're advancing your patient journey maturity as a whole. You know what your line in the sand is, and you know that these 3, 4 ideas are going to move that line or that score up. It is an awesome way to make your brand stand out, help deliver better care, quality care to your patients, and ensure that they are front and center of your strategy. Thank you for spending time with us. We hope that this was helpful. Again, this is webinar 2 out of a series. There's a total of 5. So please check back with us later. We'll offer this video up for download. And if you have any questions, feel free to reach out to Alec or myself. You can reach us both on LinkedIn. There's our addresses there, or you can hit us up through the website through propane.agency or propane.health. Again, thank you very much for your time and have a great rest of your day.